Hey, my name is Dr. Tariq Elsayegh. I'm a local Windsor addiction specialist. I work in inpatient and outpatient settings as well as correctional facilities and residential treatment. I'm here to talk about the addiction situation that we are facing in Canada and specifically in the Windsor and Essex area. Unfortunately, this is an ever-growing problem. Currently, Statistics Canada states that 1 in 5 individuals will qualify for some sort of a substance use disorder. Addictions is prevalent. In Windsor, Essex alone, there's been over 105 overdoses due to opioid-related deaths in 2023 alone. And of course, there's a lot of undocumented and unknown causes of death that probably increase and amplify those numbers. This issue is not getting better. Unfortunately, the services that are available in the Windsor-Essex area do not meet the supply of the ongoing prevalency of addiction care. Currently, with regards to treatment and availability for individuals or patients suffering with addictions and mental health is very limited. Between facilities like withdrawal management and inpatient addictions, the next level of care would be in-house treatment, which has become a very difficult access point for many individuals looking for further treatment. Wait times can exceed months, especially when this is a crucial point of trying to retain clients to enter residential treatment, because unfortunately addiction is free-floating, and if there's opportunities to get patients in, we don't have the beds to support their needs. In-house treatment is integral in terms of the recovery process. It's vital in providing support for recovery planning and discharge planning, but most importantly, reintegrating citizens and patients back to the community in a safe manner. Outside of the in-house treatment, the aftercare part of addiction medicine is as important for recovery, in the sense that patients require constant psychotherapy that would help them stay clear and free from substances past their time and duration in inpatient care. Like I said prior, we are really lacking in terms of beds and availability for these clients that are suffering and willing to attend in-house treatment. So what has inspired me to start a career in addiction medicine occurred during my residency training back in 2017. Along my training, I had met a lot of individuals, some whom were in inpatient settings at the hospitals or even incarcerated at the time, that were going through significant substance withdrawal. At the time, I was very new to the field and not really understanding the consequences of using drugs extensively. It was a very heartbreaking experience, and I felt that there is so much that can be done for patients that are struggling with substances, and we needed to make access as easily and available as possible. So I had a goal that once I finish my training, I'm going to do everything to make the barriers non-existent that could be in the way of patients seeking recovery if they wanted to do so. And this leads me now to the Essex Manor, which is a residential treatment center operated by Kathy Edwards, who's been an instrumental partner in recovery in the area of Windsor and surroundings. She has developed an amazing program at the Essex Manor, which is an inpatient facility. The Essex Manor will be providing sober living and ample medical resources to support patients during their recovery process. It is an initiative that we need to support. I personally will be providing medical services in conjunction with a multifaceted team to help patients get back and get on track during their time in the Essex Manor and when they are reintegrated back to society. So below this video is a GoFundMe page to support the Essex Manor. As I have mentioned, it is an integral part of our community. There is absolutely no government funding and everything is privately owned, so any penny would count towards keeping this project viable.